Well, welcome and thank you all for coming today. It's really an exciting day for Dartmouth-Hitchcock. The relationship between the Mayo Clinic and Dartmouth-Hitchcock goes back 85 years, and this is just another step in that relationship. I'll talk a little bit more of the history after John speaks, but I want to welcome our colleagues from the community practices and those joining us by video conference and on the web conferencing. I also want to recognize some of our trustees who are here, Rob O'Dean, Ann Lee, and some of our physician trustees. I saw Rich and Bill. Thank you for coming today. I want to recognize one of our trustees who's not here, Hugh Smith, who's from the Mayo Clinic family, now part of our family as well. And Hugh, we miss you and thank you for what you've been doing. You know, Alan Sessler was another member of our trustees from the Mayo Clinic history back in the 80s and 90s. And this year, Dr. Denny Cortez was recently elected to our trustees, who was John's predecessor as CEO and president of the Mayo Clinic system. So this is a tremendous opportunity for us today to come together with our colleagues. I want to thank Angie and Mary Jo from the Mayo team for the work that they've done to bring this together. Steve LeBlanc and Jason Aldis, who've done tremendous work for us here at Dartmouth to pull this together. We're all involved in this kind of crazy world called healthcare today, but one of the great things is the people that you get to partner with. And together, Mayo and Dartmouth-Hitchcock will create a new family that will help patients in this country in ways we've yet to think about. And we're really excited about that. I'd like to introduce my colleague and friend, Dr. John Noseworthy. John, thank you for coming.
Thank you, Dr. Weinstein, for your warm welcome, and congratulations to all of you for your ongoing commitment to meet the needs of your patients, to teach the next generation of healthcare workers, and for your groundbreaking research. Whether through work on the Dartmouth Atlas or meeting the needs of your patients every day, the Dartmouth name is synonymous with excellence through decades of commitment and service. As pioneering leaders in efficiency and effectiveness of care delivery, you've long recognized that healthcare in America is at a crossroads. Today, more than ever, providers are seeking meaningful relationships such as this one that allow them to best address their patients' needs, improving efficiency and effectiveness of care. Mayo Clinic is proud to have partnered so closely with Dartmouth through countless projects, including the High Value Healthcare Collaborative and others. But we're even more proud today to be here to announce an exciting new way that our two organizations will work together to build on that history of collaboration to serve patients throughout this geographic region. Teamwork is an essential value of Mayo Clinic. Our founders used the language that a union of forces is required to best serve the needs of patients. A union of forces. A singular focus on the needs of the patient and teamwork. That's the essence of Mayo Clinic. The three essential strategies of the Mayo Clinic Care Network include the following. Number one, redefining the value equation and what it means to deliver effective care, better patient outcomes. Number two, accelerating the transition from research and discovery to the bedside, to patient care. And number three, transforming the healthcare workforce and delivering the next generation of healthcare professionals. We will work together with all our partners in the Mayo Clinic Care Network to create a transparent, networked healthcare system that is data-driven, evidence-based, individualized, and rewards results rather than activity. Our goal, a more effective, sustainable healthcare system in this country, one that's economically sustainable and based on the best possible patient outcomes. As a society, our challenge is significant. We can continue to follow the current path, one that's inefficient, fragmented, and economically unsustainable, or we can adopt a new approach reflected in the Mayo Clinic Care Network, an integrated, data-driven model that puts patient outcomes first, pays for results rather than work, focuses on value rather than cost. We're absolutely thrilled to welcome the entire Dartmouth-Hitchcock care team of more than 7,500 dedicated professionals to the Mayo Clinic Care Network. We can do so much together, building on this tradition of collaboration between these two outstanding institutions. We're really thrilled. Thank you.
Thanks very much. Again, my name is David Hayes. I'm here in my role as medical director of the Mayo Clinic Care Network. I'm a cardiologist as my day job, but this has been a very interesting initiative that we've started about a year ago. If you walk around the Mayo campus, and this really is not an exaggeration, if you walk around any of our campuses and you ask any level of provider, from desk attendant to physician to nurse to technician, what's Mayo all about? The answer you will get is the needs of the patient come first. And by that, they'll go on to say it's about delivering the best care that we can. When we talked about how do we extend what we do at Mayo, how do we extend knowledge and expertise so that what we do may perhaps be of help to others, we came up with the concept of the Mayo Clinic Care Network. Yesterday I was asked by a reporter, how do you look at groups? Who would you think about being a member of the Mayo Clinic Care Network? And the simple answer is we look for culturally similar organizations, like-minded organizations where the patients come first, where it's all about high-quality care. And if you think about that, who personifies that more than Dartmouth-Hitchcock? So as we've been working with Dartmouth after the opportunity arose some months ago, and we've been working with the Dartmouth team, which has been a real pleasure over a number of months now to make this happen, we can tell that this is going to be just a perfect extension for the Mayo Clinic Care Network. The Care Network is based on clinical tools. We feel that the expertise of Mayo Clinic revolves around our clinical expertise, so it makes sense that the Mayo Clinic Care Network is about clinical expertise and clinical tools. How we can work with an organization where we already have a long history, a very rich history, and can now extend that for the needs of the patients. So we are excited to be here today. We think that it's very important for the Mayo Clinic Care Network to now be welcoming Dartmouth-Hitchcock into this group, and we think it'll be wonderful for both organizations. And to commemorate this, I'd like to present to Dr. Weinstein and Dr. Meyer this plaque, which is very heavy, and reads Mayo Clinic Welcome.
Greg's going to carry it.
Welcome Dartmouth-Hitchcock to the Mayo Clinic Care Network. Thank you very much for all your help.
Thanks, David. Fantastic. I think the comments and David's comments resonate with me so well. Many of you have heard me in the community talk about creating a sustainable health system. And it was interesting to listen to John's words, almost being exactly the same, talking about value, not volume. And as I look at Elliot and Carol and the leaders of our Dartmouth College community and TDI, I think about this is all about what we're about here at Dartmouth. And the commonalities and the things we can bring together with our medical school, with Chip, our dean, Chip Shoba. It's such a wonderful opportunity for so many of us on so many levels. And when we talk about patients, isn't that what it's all about? We're so blessed to be in a profession where we can take care of others in their times of greatest need, and to do that with partners that put that first. And if I said any one word to describe Mayo Clinic, and what I've heard Mayo Clinic people say, it's quality. If you get the quality right, everything else happens. And this is all about quality as an organization and as in a relationship. I look forward to many, many decades of this growing and exploring new opportunities to make other people's lives better for our country. We will create a sustainable health system, not just for our organizations, but for this country and hopefully for the world with this model. John and David, thank you, and thank you for your team. We're proud to be part of this network.
Thank you, Jim. Thanks very much. Thank you. Well said. Very nice.
Questions? Somebody ask a question. Okay, over here right behind you, Rick.
This is a question from the internet for any of you gentlemen. Dr. Noseworthy, you mentioned the high-value healthcare collaborative in your remarks. How does this new agreement impact, or how does it work with the high-value healthcare collaborative?
Did you all hear that question? So thank you very much for that. This is an independent activity from the high-value healthcare collaborative, but it builds off decades of trust and relationship between our two fine organizations. The Mayo Clinic Care Network is primarily about patient care. We're a very active member of the High Value Care Collaborative. That's thriving, it's mature. The work that Jim and the team are moving forward, and that is changing the way healthcare is being understood in this country. But this is a separate, if you will, activity between these two like-minded organizations.
I might expand a little bit just for conversation's sake that you know, when we started this work, Jack Winberg here at Dartmouth looked at small area variation. Of course, Elliot and others have carried that on. And that sort of pointed to some of the issues. But Mayo Clinic, along with Intermountain, and now many other organizations have joined us in looking at how do we actually change healthcare from the provider side, from organizations like Dartmouth-Hitchcock and like Mayo. Together, we will change the country. There's tremendous work being done in Washington and across the country on healthcare, the healthcare legislation, ACA. But part of this is really organizations taking the lead. And us in this collaboration working together is just going to accelerate that. And the collaborative is just a piece with other like-minded partners wanting to get the right value out of healthcare for patients. Another question, please? Yep.
This may not be the proper venue, but could you give us some details of what this relationship means in terms of step one, step two, step three? What are projects? We have a relationship currently with Mayo as a reference lab. Is there a financial benefit in terms of the significant outlay that we put out for purchasing reference laboratory services?
Mm-hmm. Yeah. Do you want to talk about the network and
days? You know, again, this is the welcome. It may
let me start out more broadly, and I think David can talk specifically to the network because that's what this announcement's about. As I said in my introductory remarks, and you echoed this, we've had relationships with Mayo in many ways, like others around the country for decades. For us, since 1927, when Dr. Bowler came here, having worked with Charles Mayo at the Mayo Clinic to start the Dartmouth-Hitchcock Clinic. So our foundation, our very foundation, lives in the roots of Mayo Clinic. So this isn't like a new thing. 85 years later, they've created a network that we've become part of with very specific deliverables within that network. That's not the extent of the relationship as you just articulated. And we have many opportunities across our research, our educational opportunities, our medical students, our college colleagues, our business school, our engineering school. They're involved in so many things that we're involved in a similar way that we have yet to explore all the possibilities. But today, I think David and John articulated around the network specifics around e-consults, about Ask Mayo, some back office kinds of things. Those are where we're starting in this relationship, but it will expand.
One of the challenges we've had is sort of bringing up the sort of data mining that we need for this effective care. Will we be able to tap into Mayo's larger potential resources to take advantage of their data mining using our information to expand our knowledge base for better care for both?
Yeah, I'd want John to answer as well, but obviously through the High Value Collaborative, we're already sharing patient data. We've already published data on large populations. And John's comments about evidence-based medicine, I mean, it's all around data. Obviously with our work here at Dartmouth, we're extremely interested in data. that's one of the parts of the relationship I think that's going to be explored and is really exciting. If we're going to manage population health to create this sustainable health system, data is essential. Many of you have heard me talk that we're flying healthcare airlines, and healthcare airlines, if any of you have flown it, doesn't have any instruments, doesn't know where it's going. And you know, we make a lot of decisions in healthcare absent information. Part of our relationship working together is to get that information and have the new airline actually know where it's going, healthcare. And we're going to help guide that. So John, did you want to comment further?
Well, I very much appreciate the question. I think Jim answered it very well. Today is about a piece, the foundation of where healthcare is going for Dartmouth-Hitchcock, for Mayo Clinic, and I believe for the country, although that remains to be determined, will be on understanding how do you get better outcomes, safer care, happier patients, get the diagnosis right the first time, all that stuff at the appropriate cost so that it's sustainable, so that the country can have a strong, patient-centered, teamwork-based, data-driven, transparent, renewable resource called healthcare. The questions you asked are specific, and I can't answer those today, those specific questions, but these two organizations see the world, as Jim said, in very much the same way, that this is about data, it's about patients, it's about better care for our patients, rather than how much does it cost. We have to deal with the cost issue. There's absolutely no doubt about that. But it's an awful lot more expensive to get the diagnosis wrong 2 or 3 times, do the wrong operation, do more than you need to do, or do it in the wrong order, and have unsafe outcomes. As you all know, Dartmouth is one of the key authors of this approach for the country. So that's a bigger issue. But these are two trusted organizations that have worked together more than ever recently. So I'm very optimistic that this relationship will be outstanding for our patients. That's what this is about. It's really about our patients. And Jim very nicely speaks to the nation, and I respect that entirely. The nation, I hope, will listen and follow, but you know, that's a much tougher issue.
Darn.
But I think, you know, Jim is a pioneer in that area. We have pioneered. Dr. Cortez, who's coming on your board, and others from Mayo have been working very hard at that. But to be completely candid, our job one are the patients of Dartmouth-Hitchcock, the people that you serve, and the people that come to Mayo Clinic, and now across our national network. If we do well with them, I hope the rest of the world will follow and help teach us. We don't have all the answers. Jim admitted that. But it's data-driven, transparent, renewable network that others can benefit from. This is the direction that we believe we need to go for our patients and hopefully for the nation. But that's a bigger question. But thank you for your question.
Another question, please? Rick, you have one?
Yeah, we have several from the internet, but here's another. How does this relationship bring the cost efficiencies that are so important and critical in healthcare today?
Want to take that, Greg?
I think it's important for us to start with what does this mean for our patients? What it means for our patients is the potential opportunity for me as a primary care provider when I'm seeing someone who asks for a second opinion to be able to tap into the expertise of the Mayo Clinic to help keep that care local. That's going to be incredibly powerful. What else it means, though, is the opportunity for us to work together. And when we're working together, we're going to be able to start to build on this foundation and understand how we approach these patients in a best practice way to help share the evidence and apply it in a very, very efficient manner. The beauty of this relationship, and it's going to be a beautiful thing, is that we have very closely shared mission and values with that focus on the patient. But at the same time, we recognize that what this nation needs is for us to become efficient and to improve that value. And I think by keeping that care local, by leveraging these tools which we'll have access to through this relationship, and then building on that by going deeper and looking at how we can learn from each other, we're going to be able to deliver great value for patients through this.
Linda? Yeah.
Good morning, and thank you for coming to Dartmouth-Hitchcock to make the announcement. We're honored that you did that. Dartmouth is unique in its small rural characteristic. There's advantages and challenges to that. Can you comment on what you think the rural nature of our care might bring to the Mayo Network, and how we will advantage each other from that perspective.
You looked right at me with that question, so I'll I believe you're addressing it to me.
I was.
Thank you very much. Care of patients in rural America is absolutely vital to the success and strength of the country, number one. Number two, Mayo Clinic, although we are well known, I believe, for our care of patients with the most complex of care, like you, also care for patients in rural America, patients with primary care needs, and manage populations of patients with common but difficult to manage and expensive to manage care. We have the Mayo Clinic health system of 71 communities in the upper Midwest that see 2.5 million patient visits and 500,000 patients face-to-face in any year, single year. So we have a Mayo model of community-based care, which we're applying and refining and learning from. And a point that Jim perhaps didn't emphasize as much as I would like him to have emphasized is that this is a bi-directional conversation that we're having. And in fact, across our network as we build it out, it will be a true network where we will be able to learn from those with best practices, be it in southern New Hampshire or in Montana or in Arizona or in Florida or wherever else this takes us, and rapidly understand that, study it, and then diffuse it across. So the Dartmouth-Hitchcock model of community-based care, if you use that language, and the Mayo Clinic model of community-based care are probably quite similar, quite evolved, but there are probably differences, and we can learn from that together to provide better care, better outcomes at lower cost. And if you weren't outstanding in that and focused on that, we wouldn't be here today. So we hope to learn from what you're doing. Medicine is very complex, and you all in this room understand that. And it's moving more rapidly than ever. And so every physician and every other healthcare provider can learn from each other. And Jim mentioned the alignment of the values and principles of our organization. And you all know when you have the culture that sees it the same way, you can do an awful lot of things. So we look forward to learning from you, sharing our learnings from around the country. And again, for our patients, this will be a good thing. Thank you.
Thank you.
Questions?
Jim, I have a question from the community group practices.
Okay.
Will individual clinical sections be able to work together on patient care issues through this collaboration, and what's the timeline?
Yes. Of course. You know, I think we're starting out with neurology and cardiology and working with the sections and departments to do that work. And in our organization, I think Jeff Cohen, I don't know if Jeff's here, has been sort of the lead in the neurology department, who's actually been at the Mayo Clinic in the past, and in cardiology with Ed Catherwood starting in that space. But then we'll expand it out across the organization. So the answer is yes, and it's not just Lebanon, it's our whole organization. And that's really important to understand. We're one Dartmouth-Hitchcock, and Mayo Clinic, which is also expansive in many states. We're coming together as a family to take advantage, as John said, of learning from each other. And where we can find out the best thing to do, wherever that little nugget is, let's get that nugget into the mainstream and let everybody benefit from it. And that's what we're going to do. Well, thank you all for coming. We really appreciate it, and we're so happy that you could spend some time with us. And John, thank you again, and David, thank you for your work. We really appreciate it. Thank you so much.